Hi! Welcome to Inference. In this video, I will be talking about obsessive-compulsive disorder and how to overcome it. Obsessive-compulsive disorder, OCD, is a mental health condition that causes a person to have unwanted thoughts, feelings, or urges, obsessions, that make them feel driven to do something repetitively, compulsions. Common examples of compulsions include hand-washing, counting, checking, or repeating certain phrases. These compulsions are often aimed at reducing anxiety caused by the obsessions, but they may ultimately interfere with daily life. The exact cause of OCD is not fully understood, but it is believed to be related to a combination of genetic, brain, and environmental factors. It is typically treated with a combination of therapy and medication. Genetics. Studies have shown that OCD tends to run in families, suggesting that there may be a genetic component to the disorder. However, the specific genes involved are not yet known, and multiple genes may likely be involved. Brain. Research has suggested that OCD may be associated with abnormalities in certain parts of the brain, particularly the basal ganglia, which is involved in controlling movements and thoughts, and the orbitofrontal cortex, which is involved in decision-making and evaluating the significance of the information. Abnormalities in the levels of certain neurotransmitters, such as serotonin, may also be involved in the development of OCD. Environment. Some researchers believe that certain life events, such as childhood abuse or infection with a certain type of bacteria or virus, may increase the risk of developing OCD. Studies have shown that people with OCD tend to have higher rates of certain infections, such as streptococcal infections, than the general population. Other environmental factors that may play a role include stress and major life changes. It's also important to note that OCD can develop at any age, but most people typically develop symptoms in their teenage years or early adulthood. It can be triggered by a traumatic event, or it may start gradually and get worse over time. The development of OCD is complex and multifactorial, and it's not possible to point to one specific cause for the disorder. Treatment for OCD typically includes a combination of medication and therapy. The main medications used to treat OCD are selective serotonin reuptake inhibitors, SSRIs, which work by increasing levels of the neurotransmitter serotonin in the brain. Antidepressant medications, including SSRIs, can be effective in reducing symptoms of OCD. Cognitive behavioral therapy, CBT, is the most effective type of therapy for OCD. It's mainly focused on teaching people how to change their thinking patterns and habits that are related to OCD symptoms. Exposure and response prevention, ERP, therapy is a type of CBT that is specifically designed for treating OCD. It involves gradually exposing the person to the source of their obsession and teaching them to not engage in compulsive behavior. This therapy can help people learn to tolerate the anxiety that comes from their obsessions and ultimately reduce their compulsions over time. It's important to note that, while it's not always easy, with appropriate treatment, many people with OCD can manage their symptoms and lead fulfilling lives. It may take time to find the right treatment plan, but working closely with a mental health professional can make a big difference. Another type of therapy that can be effective in treating OCD is called acceptance and commitment therapy, ACT. This therapy emphasizes the acceptance of difficult thoughts and feelings, rather than trying to fight or eliminate them. It helps people learn to relate to their thoughts and feelings in a different way, which can make them less distressing. In addition to therapy and medication, other self-help strategies can be beneficial for people with OCD. These include practicing relaxation techniques such as deep breathing, keeping a journal to track symptoms, triggers, and progress, eating a healthy diet and getting regular exercise, getting enough sleep, practicing mindfulness. Connecting with other people who have OCD, either through support groups or online forums, can provide a sense of community and validation. It's also important for people with OCD and their loved ones to be educated about the disorder so that they can understand what is happening, why it is happening, and what can be done to help. When living with OCD can be overwhelming, seeking professional help and support can make a big difference. Another thing to consider is that OCD can be comorbid with other mental health conditions. It's not uncommon for people with OCD to also have depression, anxiety, or other disorders. This can make treatment more complex, but it also means that addressing all of the coexisting conditions is important for achieving the best outcome. Furthermore, since everyone experiences OCD differently, treatment must be tailored to the individual's needs and preferences. What works for one person may not work for another. So, the treatment approach should be flexible and adjusted as needed. And, it's also important to have realistic expectations about the treatment and recovery process. While treatment can be effective in managing symptoms, full recovery may not be possible for everyone. But with the right support and treatment, people with OCD can learn to live well with their condition. It's crucial to seek help as soon as possible if you are experiencing symptoms of OCD. Early intervention can make a big difference in the outcome, as the earlier treatment starts, the better chance of recovery and symptom management. It's also important to note that there are different types of OCD. Some people may have primarily obsessions, while others may have primarily compulsions. Some may have both obsessions and compulsions. Different subtypes of OCD can present with different symptoms, which is why it's important for a mental health professional to accurately diagnose the condition and tailor treatment accordingly. One common subtype is called contamination OCD, where the person is obsessed with avoiding or getting rid of contaminants. They may have compulsive hand washing or cleaning rituals to avoid perceived contaminants. Another subtype is harm OCD, where the person is consumed with fear that they may harm someone else. They may have compulsive checking rituals to ensure that they haven't harmed anyone. Another subtype is scrupulosity OCD, where the person is preoccupied with fears of moral or religious wrongdoing. This type of OCD may manifest as excessive guilt or shame, leading to compulsive confessions or prayers. So, it's important to know that OCD symptoms can manifest in different ways, and not all people with OCD will experience the same set of symptoms. That's why the person with OCD must receive an accurate and specific diagnosis and tailored treatment plan from a mental health professional. Lastly, it's also important to note that the stigma surrounding OCD and other mental health conditions can prevent people from seeking help. People with OCD may be ashamed or embarrassed by their symptoms and may be reluctant to tell others about them. They may worry that others will judge them or think they're weak. It's important to remember that OCD is a real medical condition, and it is not something that can be controlled or easily overcome by willpower. With the right treatment, support, and understanding, people with OCD can learn to manage their symptoms and improve their quality of life. It's crucial for loved ones and friends to be supportive and understanding of the person with OCD, and to encourage them to seek help. In conclusion, OCD is a complex mental health condition that can affect many areas of a person's life. With appropriate treatment, people with OCD can learn to manage their symptoms and lead fulfilling lives. People need to understand that OCD is a real medical condition and not a choice or a weakness. Early intervention and tailored treatment can make a big difference in the outcome. And if you are experiencing symptoms of OCD, please don't hesitate to seek help. Alright, folks, that is it for this video. I hope you enjoyed it and learned something new about obsessive-compulsive disorder and how to overcome it. Thank you for watching. Have a good one. Goodbye.